Good morning y muy buenos días a todos. It's truly an honor to be here today. And I know Dr. Ferrer really did want to be here with all of you, and I am very honored that she's asked me to step in and do the plenary presentation this morning. You heard about Hep A. There's a lot going on in our department right now, but all of what we're trying to do is refocus our work with that social and health equity lens. And that's what I'm going to talk a little bit about this morning. But before starting that, I just really wanted to say how wonderful it is to be here. Many of you I've worked with throughout the 30-plus years that I've worked in LA County, and it's so wonderful to see where we've come and the kind of work that we're doing now together. And a special shout out to both Rita and to Ellen for the amazing work that our Office of Women's Health does in partnership with organizations like all of yours so that we can put on forums like this and be committed to making sure that we hear from our community partners, from our academic partners, from our business partners, from everybody as we move forward on changing the environments in which our communities live. Let's see if I can make this work. Yes. So just briefly, these are the themes I'm going to be talking about today, social determinants of health and their impact on the health of our communities. I'm going to talk a little bit about reproductive health and some of the issues that we're concerned about in reproductive health. Environmental justice issues, some of the issues our department has been facing over the last couple of years, and our work to prevent many of these issues from resurging. And then our work around a health equity lens for all of the work that we do in our department. So what's a healthy community? Well, you see a couple points on it here. In the past, when we talked about health, we talked about making sure people had access to medical care. And yet, health in communities is so critical, and we know that a healthy community is one in which there is safe and sustainable and accessible and affordable transportation, that's a key part of people being able to be healthy. We were talking this morning about whether we had good metro transportation in LA. Well, we're not there yet. We know that. And we know some of our communities are not as walkable as we would like them to be. And some of our communities aren't friendly to bikes. But this is work that we're all working on together to improve the way our communities are designed. A healthy community has to have accessible and nutritious food and safe drinking water. It has to have affordable housing that is also offers socially integrated kinds of activities to bring people together. There has to be access to health care. Don't get me wrong about that. And wonderful healthy communities include green space and parks and good schools and childcare and libraries and financial services and other things that help people meet their daily needs and improve the overall quality of their life. Having safe access to physical activity is really important. We've seen over the last couple of years an epidemic of obesity in many of our communities, and the tendency in the past was to say, well, we just need to teach you about how to eat healthy. Well, you can't eat healthy if you don't have access to healthy food. And you can't, engage in physical activity if you're not feeling safe in your neighborhood to go out and walk or use those parks. So those are all the kind of issues that we together need to work on. We want to make sure that a healthy community is also a beautiful community and has access to arts and music and culture as vibrant ways that reflect the traditions in the communities where people live. I said a little bit about this, but many people define health as your ability to get health in the four walls of a medical office. And as you can see from this slide, clinical care really only contributes to about 20% of people's ability to be healthy. It's these other factors in the physical environment and the social and economic environment that play a much bigger role in people's ability to be healthy. And our work is driven by the fact that those neighborhood environmental factors, from the local economic opportunities, the ability to earn a living wage, to social interactions with neighbors, feeling safe and knowing the people that you're living with in your community, to the physical environment, whether you can walk or bike or feel safe, to having local services such as grocery stores and banks, all impact individual health. And so that the traditional idea of public health being publicly funded health care is no longer what we as public health professionals across the country define our work by. We define it by an ability for us to improve the communities in which people live so that healthy choices are easy choices and choices that we have worked on together. And we move away from blaming individuals for their health outcomes to thinking collectively, what is our role in improving the factors in communities that allow people to be healthy? Just a quick definition of the environment you can see here from Merriam-Webster. The environment can be defined as a complex of physical, chemical, and biotic factors, the climate, the soil, the living things that act upon an organism or an ecological community and ultimately determine its form and survival. And I like the second part of it. It's an aggregate of social and cultural conditions that influence the life of an individual or a community. We talk about the social determinants of health, the array of social and environmental factors that can impact one's ability to achieve a healthy status. Things such as poverty or housing ability, early childhood education, access to primary care, access to healthy food, incarceration, and racial discrimination all play a key role in the ability for people to live healthy lives. And just as an example, there was a study done in 2010, and it just gives you an example of how we are beginning across the country to think differently about how we intervene in public health areas. And I know that many of you today will be sharing your own examples of how you are intervening differently in communities, how you are leading differently, how you are addressing problems with a different set of eyes. And that's why today's gathering is so important. But we looked at food insecurity. And this was a study done in 2010, and it found a high correlation, no surprise here, between food insecurity and chronic diseases. People that were experiencing high levels of food insecurity were also experiencing high levels of hypertension and diabetes. And so the intervention was a food bank, not kind of more counseling for people on how to eat healthy, not more clinical visits, but it was really a food bank that provided free foods that were part of a diabetes prevention or a diabetes appropriate diet. And they analyzed the impact of this across the clients, the 700 clients that participated in this, and the effect of the appropriate foods reduced people's glycemic A1C and increased their self-management and support of their diabetes and hypertension. So it's a different kind of intervention. It's not about the clinical, although clinical is extremely important. It's about providing those things that help people to be healthy. So another kind of example about understanding social determinants and why their impact on health is so important. Because if we don't understand the underlying conditions, we can't come up with the right solutions to solve the health inequities that we are seeing in our county, in our state, and in our country. And so, one of the other things that we are focusing on both internally and how we reorganize our services in our department and in the county as a whole is looking at racial discrimination and the impact that that has had on people's access, fair access to services, the ability to accumulate wealth and other things. And you all, I'm sure, are aware of redlining, a government-condoned practice where banks refuse to grant home purchase loans in certain areas based on their ethnic and racial composition. This was clearly a problem for African Americans and for Japanese Americans in not being able to buy homes in certain neighborhoods. And this practice then limited their ability to accumulate wealth. It led to a reduced tax base and decreased capital investment in critical community infrastructure, such as parks and schools and the kinds of businesses. And there have been other kind of racial policies like that that have limited and diverted critical resources away from many of the low-income communities of color. And so we are now looking at ways that we can, and we're part of something called the Government Alliance on Race Equity, where we're looking internally at the kind of policies that we currently have and ways that we can change those policies to make sure that we are not continuing this legacy of discrimination that has impacted so negatively many of the communities in LA County. I'm sure you know this better than I do, but a couple of statistics. We're over 10 million people now. 1 of every 4 Californians lives in our beautiful county. And we have more people so if we were a state, we would be the 8th largest state, right after Michigan. So oftentimes when, anybody here from the state of California? It's okay. Okay, you're probably going to get pissed off with what I say right now, but I'm going to say it anyway. It's often very difficult for LA County to get its fair share of resources in the state because we're one of 58 counties. And yet, we're as big as many other states. And in many ways, we probably need to be dealing directly with the federal government on our share of resources for programs and things so that we could get the kind of resources that we need to intervene effectively in many of the communities. So my apology to the state partners, nothing against you all, you do amazing work, but it's a little pet peeve for LA County. We have immense diversity in our county, immense diversity in our county. And you can see that. It's probably hard to see these numbers, but there's not only diversity across our entire county, but across the way in which our geographical planning areas are designed. So if you look just at, for example, the west area, which is the blue, and I apologize, it's hard to see that, but the west area, there are about 16% Latino, 64% white, and 6% African American, compared to South LA, a service planning area which hits right next to it, where we have 68% Latino, 27% African Americans, and 2% white. And so it's interesting, this sort of geographic and racial ethnic boundaries that we have in our county. And we see all kinds of impacts of that when we look at other things that we map out. So, for example, if we look at where we have safe places to recreate, you see a huge deficit. That red is a deficit of parks and places for people to have safe access to recreation, which aligns with our South Spa and some of our more low-income communities and communities of higher numbers of people of color. Same thing with our food deserts. Where do we have the worst problem with our food deserts? They are also in some of those same communities in the south area of our county. And if we look at those communities that are heavily burdened by multiple sources of pollution, it also lines up the same way. Okay, just a quick snapshot of women in LA County broken out by age and race. You can see here that different ethnic groups have larger proportions of women of reproductive age. You can see that Latina and Black and Asian and have higher percentages of women of reproductive age than white women. Interesting, white women have higher percentages of older women. And I think that's reflective in many ways of the immigration and other factors that we're dealing with and that make our county very strong. A little bit about birth statistics. We have 2.5 million women of reproductive age in LA County. We have about 130,000 births per year. 1 in 30 births in the country are in LA County. 1 in 4 births in California are in LA County. And 1 in 3 births are to a woman who is less than 24 years old. We have about 62 delivery hospitals. Again, dealing with reproductive health and trying to improve conditions there, you can see the scale of what we're dealing with. And if we look at some of the issues that are most critical to us in reproductive health, African American and Native American babies are at least 2 times more likely to be born premature or low birth weight. And you can see that in this slide. And this slide just, I find unconscionable, that maternal mortality, women who die in pregnancy or die in delivery, and you look at African American women at 62.7 versus 13.6 in white women. This is just unacceptable in this day and age. And unacceptable are infant mortality rates. And one thing about infant mortality, LA County's done a tremendous job of lowering infant mortality overall due to the work of many of you in this room that work on reproductive health and women's health issues and women and children's issues. You can see that we're below the HP 2020 goal at 4 deaths per 1,000 live births, and that overall, for all race ethnicities, the infant mortality rate has gone down. But the gap between black-white infant mortality has increased. And from when it was about 2 times different before, now we're over 3 times greater where African American babies die compared to white babies. And that's just unacceptable in 2017. A little bit about percent of low birth weight by mothers, race, ethnicity, and nativity. This is interesting, and Michael Liu was mentioned earlier. He's done some of the pioneering research and work on this, that women born in this country fare worse than their counterparts that are foreign born. So what is it about our environment that is causing this difference? It's something that we all have to look about. And traditionally, when we talk about infant mortality, we talk about programs that serve the mom. She's just not getting into prenatal care early enough. She's just not doing the things her doctor told her. Well, she should be in high care, and we just need to get her to that high-risk care, and then she'll do better. You can't fix in 9 months of pregnancy a legacy of discrimination and underinvestment in the communities and where people live. And we can't put that blame on mothers anymore, that it's your fault that your baby died or it's your fault that you did bad in pregnancy. This is about all of us and all of our responsibility, and how do we hold ourselves accountable to improve this in the future. A little bit about stress. I mean, you can see from this that those that have low birth weight babies, particularly African American mothers, that have had 3 or more stressful kinds of events, and these stressful events can be things like your partner getting put in jail, becoming homeless. We're talking about discrimination, heavy-duty things here. You can see it's having an impact on the low birth weight outcomes. And this traumatic and toxic stress during pregnancy is having an impact. Again, some of the sources of that stress that this data comes from our LA Mommy and Baby Survey, a population-based survey of women that have recently delivered birth, and we have a companion survey of women who have lost their baby called LA Hope. So the LAM and the LA Hope survey give us kind of data about women's experience prior to pregnancy, during pregnancy, and after pregnancy to help us to begin to think about the kind of strategies that we need to invest in to improve things. Neighborhood characteristics play a huge role in women's birth outcomes, and in this question they're asked about their safety from violence in the neighborhood that they lived in, and only 25% of white mothers reported that their neighborhoods were not safe, compared to 52% of Hispanic women or Latina women and 54% of African American mothers. So if you don't feel safe, you can't go out and exercise. That level of constant stress on your body has an impact. And then when we ask women in the survey about their experiences of discrimination, more than 1/3 of LA County mothers report experiencing at least one incident of discrimination over their lifetime. But African American mothers cited race and income, gender at higher rates than other racial ethnic groups. So this is a huge issue that we need to address. So just quickly, I'm not going to, I often go and do a whole talk on what we're doing around reproductive health, and I need to move on from that. But So what are we doing to improve reproductive health? Well, we are working in many ways to improve the conditions in communities so that we can help to improve the conditions of women's health, which will in turn improve pregnancies. And so one of the programs I want to call out is in our chronic disease prevention program called Policies for Livable Active Communities in the Environment, our PLACE program. And that program has pulled together all of the county departments, the Department of Planning, the Department of Parks and Rec, the Department of the Arts Commission, the Department of Public Works, to think together, number one, about how we go after funding to improve communities together so that we don't compete as different departments with each other. Two, how do we put health front and center in all of the planning decisions that our county does? And how do we get this embedded permanently in our general plan so that health is a consideration before we build a new school, before and where we site it, and where we use our resources for infrastructure and communities. And they've done a number of things, including a bicycle plan, talking and using funds to hire youth and communities to plant trees, to improve sidewalks, looking at how to make communities more walkable, look at how we prevent traffic incidents by making crosswalks better for people that are on foot, and then looking at soil and water testing guidelines for community gardens. They're doing a lot of work to think about the infrastructure and to change the environments in which people are living. And then we're linking women and families to enhance systems of care. I saw one of our staff from the Nurse Family Partnership, one of our home visitation programs. Thank you for being here. Anybody else from the Black Infant Health Program that's here today? Thank you for being here. These are some of the programs that we have that focus attention and support. And I know Lynn Kersey's here, and she's had an amazing legacy of providing case management and support to women in low-income communities and women of color. There are other numerous programs that are, but our goal is to help expand these programs to make sure that women that need these services find them easy and accessible, and that they're funded robustly enough so that we can support women and families. And then looking at our third thing, strengthening the support systems in communities. Many of you do that work in your amazing work with community-based organizations. You are community organizers, you are advocates, and that work is really important for us to partner with you and figure out how we can support that work more robustly. We are also working through our area health offices. We have 4 area health officers, and their staff work with community coalitions on trying to address needs that are identified in those communities together. And then advocating for policies that undo racism, that create equity for all, and policies that hold health as the value front and center in the work we do in public health. So I'm going to change gears a little bit and talk about some of our work in environmental justice, which is linked to the work that we're doing in environmental health. You know, we've had over the last couple of years some of the largest environmental disasters in the country, maybe in some cases even the world, in Los Angeles County in our backyard. I'm going to talk a little bit more about Exide and the work that happened there. And I'm going to talk a little bit just briefly about Aliso Canyon, one of the biggest gas leaks in the history of this nation, at least maybe in the world. I'm going to talk about Zika and West Nile, some of the other reasons that our staff couldn't be here to join you for today's presentation. A little brief about climate change, which is underlying the increase in vector-borne diseases that we're seeing in our county, and then a few other things about how we're rethinking the work we do in environmental justice. And a huge shout out to Angelo Bellomo, our Director of Health Protection, Deputy Director for the department, who has really helped to design a different way that we approach environmental justice issues. So Exide Technologies, this is how many of you have heard about this? I'm sure a lot of you have, yeah, okay. How many of you had the opportunity to participate with us in the outreach we did? Thank you so much. Thank you from the bottom of my heart for your work with our staff in outreaching in the community. So just a brief story about this. The Exide battery recycling plant has been there basically since the 80s, but prior to that, since the 1920s, there's always sort of been a battery recycling plant on that plot of land in the city of Vernon. Exide Corporation took over the plant in 2000 as part of its acquisition of the previous owner of the plant. And in 2008, Exide was ordered to cut production in half after numerous complaints were received. And regulators at the time found that the facility was emitting lead at levels nearly twice the allowable federal limits. That's 2008, just keep that date in mind. And this investigation, again, was prompted after numerous community complaints and ash fallout and damage to rooftops across the street in the industrial area. Yet it wasn't until 5 years later, in April of 2013, that regulators ordered the operations to be suspended, and this was due to a report that the AQMD did. Anybody here from AQMD? Nobody from AQMD. Okay. This report found that there was elevated cancer risk due to the facility's pollutants. And in March of 2015, they were finally ordered to shut down. Now, we found out about this when AQMD released their report. And at the time, Supervisor Molina was the supervisor covering that area of the county. And we went along with her staff to numerous hearings at AQMD to testify about that this plant needed to be shut down. This wasn't about controls anymore. They had demonstrated that they could not operate effectively and that the solution was to shut this down. But it took until March of 2015 to eventually shut it down. And the result is there was a huge contamination of the soil in the communities surrounding the plant, up to about 1.7 miles, and perhaps even further out than that. But we knew with some assurance up to 1.7 miles that this decades-long emissions had released harmful levels of lead and arsenic into the environment and to the communities surrounding the plant. And now we are left with a legacy of contamination impacting the cities of Maywood, Huntington Park, Commerce, Boyle Heights, and portions of East LA. The workers were probably exposed to very, very high emissions from Exide as working there, and had even higher levels of developing cancer and other illnesses. And there was a health risk assessment performed by Southern California AQMD in 2012 that indicated that non-Exide workers employed near the facility, they were even exposed to incremental cancer risk based on the emissions coming out of Exide. So we had a real problem here. And now we have 10,000 homes in this community surrounding Exide that have contaminated soil. The cleanup and the testing of this falls to the state agency, the Department of Toxic Substances Control. And there they began testing. But I have to tell you, after so many years of slow response, the community was outraged. I mean, absolutely outraged. We were outraged. And it was the initial estimates of testing the soil were going to take years. And so at the time, our Board of Supervisors said, can we do anything quicker? And again, under Angelo's leadership, we looked at pulling together some consultants and a team, and we showed that we could rapidly increase the rate of testing the homes so that people could get results and know their risk. And then we could move quickly to the cleanup phase. That was our goal. And so within 10 days, we assessed over 500 homes, which would have taken 6 years based on DTSC's sampling methodology. So we quickly shared our results with the state and said, this is what we did, this is how we did it, this is the science behind it, we can do this much quicker. In fact, why isn't there urgency to do it much quicker? And then DTSC said, well, we just don't have enough funds to move quicker. We need more funds to do this. And then we had a change in supervisors. Supervisor Solis, under her leadership, stepped up and said, let's go up to Sacramento, let's talk to everyone up there. And we went with her and we testified in hearings up there. We met with the different legislators and we said, this is urgent. And as a result, $177 million were allocated to increase the testing and to do the cleanup. So it was a huge, but it required people raising their voices, and there were hundreds of people from the community that got on buses and went up to Sacramento to testify in these hearings, to talk about it, what it meant for them, their families, their children. And it, so in addition, this last June, we wanted to make sure that we did much more with this community. And so we went out to do this massive outreach. Those of you that raised your hands to help us, that helped us with this, thank you. We organized 1,500 county staff members and volunteers to go door to door on a Saturday. We reached 17,000 homes, talking to people about Exide, talking to them. We wanted to make sure we had sort of three objectives with this outreach. We want to hear from you. We want to know what you're concerned about. We want to make sure we can document that so that we can elevate it with the Board of Supervisors and with other legislators so that they understand the community concerns. We want to collect this data. It's your data. We want to give it back to you in a way that you can use to advocate for for the cleanup to happen quicker. We also want you to know that the county family is there to support you in this work, elevating your voices and making sure that we're addressing the concerns you have. And thirdly, we want you to know all the resources that the county has that we can make accessible to you. And so we did this over a day. We created a report in collaboration with our community partners. They helped us to design the survey. They were with us out in the field, delivering the survey in different homes. And some of our key findings that came out of the survey, the big finding is no surprise that those who live in the community surrounding Exide are extremely concerned about the contamination from hazardous chemicals that were released by the facility. Many of these households have children and pregnant women that either live there or visit on a regular basis. And many of them were concerned about the cleanup prioritization that the Department of Toxic Substances Control had released, which said, well, if you have a pregnant woman or you have a child there, but it didn't take into account that many of these families have their grandchildren come over and spend time at their homes. And so we were advocating for a much more comprehensive approach to cleaning up neighborhoods, not home by home, but thinking through block by block and other ways we could do this to make sure the cleanup happened quicker and more effectively. So nearly half of the households reported there are children under 6 who live or spend time in their home or yard. 3 out of 4 households reported being concerned that a person in their home might get lead poisoning or cancer from living in the neighborhood. 70% said they were concerned that someone in their home would get sick, and 65% of the households reported that their homes were tested for lead, but they had no idea what the results of that testing were. No one had come to explain to them what those results meant or what it meant for them in terms of getting their homes cleaned up. This report is online on our website, and I encourage you to take a look at it. We took the report in collaboration with our community partners. We asked them to be the ones presenting the data on this. It's their data, not owned by the health department. It's owned by these communities surrounding Exide. We wanted them to be the voices helping to present it, and we were there to support them and provide them whatever resources they needed to have conversations in those 5 communities surrounding Exide about what these results meant and what the recommendations for improvement should be. And we are working in collaboration with them and with our Board of Supervisors and with others in the state legislature and hopefully with the federal legislature as well on things that we can implement to improve the conditions in that neighborhood. Just a really quick talk about Aliso Canyon. Again, this was a natural gas leak from a storage facility. It began in October of 2015 and went through almost February. And there were a number of common symptoms that people experienced as a result of this massive gas leak. And if you have seen the little film on YouTube, it's pretty shocking of the gas and the just massive gas leaking from this field of natural gas. But people were expressing symptoms of headache, dizziness, stomach upset, nosebleeds, eye, nose, and skin irritation, and just not able to concentrate and feeling horrible when they were in their homes with this gas leak. And we worked with community residents and with community leaders on analyzing the air, on doing a survey door to door to understand how the conditions of living in this neighborhood were impacting them. We educated and addressed residents' concerns. We logged their health complaints. And we used all of this information to push back against the Southern California Gas Company and saying, you're not ready to open until you can tell us that the conditions that caused this leak in the first place are fixed. That's really important. And this was our first sort of example of using a health officer order to step in. Now, health officer orders that you probably are familiar, but they're generally used for quarantine. We've got an infectious disease. It allows us to say, you can't leave your home. You have to stay here until your mumps is over or whatever the condition is. But we began to use the health officer order in a new way to say, no, this is, even though we're not the ones that are the regulators or the companies that cause this problem, this is impacting the health of the people in our communities. And our health officer orders are going to tell those that are causing the problem to cease and desist and to prove to us that the conditions are safe enough to open and to be able to store the gas there again. So we took this into court. We were challenged multiple times in court. Sometimes we lost, but we continue to push and use this health officer order in a way that it's a new way to use a health officer order, but to protect communities. I'm going to move on to Zika and West Nile virus. Zika and West Nile virus are new. Zika's newer. West Nile virus, we've had it for quite some time. You may have seen recently in the news there's been a few deaths from West Nile virus. We unfortunately do have a few deaths almost every year from West Nile virus. And both Zika and West Nile virus, because of climate change, we're going to start seeing more vector-borne diseases in our county due to the warmer temperatures that support these vectors like mosquitoes from breeding very quickly. And Zika, of course, is concerned because of the impact it can have on the mother and her baby. Microencephaly has been seen in many women that have gotten Zika and then delivered. And we are very, very fortunate there has not been local transmission of Zika in Los Angeles County. We're trying to do everything possible to prevent that from happening. And with West Nile virus, we are doing our best to reach out, and we are soon to launch a door-to-door campaign in some of our most heavily impacted communities to make sure they understand how to protect themselves, and particularly those who are most vulnerable, elderly and people with immunocompromised systems, to how to protect themselves, to use DEET, to wear long sleeves shirts and pants. These are not, mosquito protection, because we don't generally think about mosquitoes in LA. In fact, when I was growing up, I never thought about mosquito protection living in LA. But now it's a reality that's here, and we need to educate our communities about this. But we also have a responsibility to make sure that we're educating about where those vectors are, so we don't want to have standing water so that we can prevent mosquitoes from breeding. And there's education for communities. We're working very closely with our vector control. And like I said, we're on the verge of doing an outreach in several communities in LA County. And we have already started to work with our key community partners in different parts of the county where we're seeing a higher number of either cases or of these mosquitoes. Just a little bit on climate change. We've been working on this issue for quite some time, and we've produced some briefs on these issues that talk about health and climate change and how we are addressing climate change in LA County. And we have put together our 5-point plan to reduce the impacts of climate change that have to do with informing and giving people accurate information, promoting things that people can do in communities like planting trees and different kinds of transportation systems, water and energy policies that reduce carbon emissions. All of that's part of the work that we're doing. We're providing guidance on climate preparedness to local government and community partners. We're building the capacity of our department to monitor and to address climate change issues. And in that, we are supporting Supervisor Kuehl in her role on the governing board of Southern California Air Quality Management District. We are a lead department in LA County Sustainability Council, and we are, so we're part of that collection of the county departments that are looking very closely at our own work within the county and how we can mitigate strategies and then share that with others. But what we learned from working on Aliso Canyon, what we learned from working in Exide, what we learned from several other incidents that we dealt with, a fire in Maywood of a plastics recycling plant, what we've learned in our work around other kinds of areas of the county is that this responding to emergencies is not the way we need to do this. We need to focus entirely different on how we prevent these issues from happening in the first place. And so some of our other areas of focus are how are we going to prevent these gas leaks in the future? What about oil wells and the refineries in LA County? And what are we going to be doing in partnership with our community partners about those issues? A heavy industry that juxtaposes because of poor planning decisions in the past up to residential communities where certain, as you saw in that previous slide, certain of our communities are overly burdened by multiple sources of industry and pollution. And any one of them may be in regulatory compliance, but together that burden on communities is unacceptable. And so how do we think about that with a health lens as we begin our work in this area? So we want to move from reaction to more effective ways to work on prevention. I think you all know this probably better than I do. This pyramid has been around for quite some time, talking about, the traditional things we used to do in public health are at that top of the pyramid, counseling and education and clinical interventions. And we are moving more of our work as much as possible down to the bottom of that pyramid so we can have a greater impact on more people in our county by addressing the socioeconomic factors in partnership with others, by changing the context in which individuals, the communities in which they live, by promoting healthy planning practices and other things so that the healthy choice becomes the easy choice. You today are going to be talking about air and water and soil and what are some of the upstream strategies that we can do to address those issues to improve the conditions in community. And again, I applaud you for being here to do that. And we feel very strongly that we need to have an environmental justice lens, a different kind of lens for how we do this work in communities that recognizes that many of our low-income and communities of color are more likely to face that larger range of environmental hazards that are contributing to their poor health and health inequities. And their high industry is more likely to operate in close proximity to their neighborhoods. And high-risk industry in those areas are more likely to have substantial and prolonged regulatory non-compliance. That's unacceptable. They're also more likely to face poor housing stock that has higher rates of lead-based paint, poor quality or other neglected infrastructure like parks and schools, and degraded indoor and outdoor environments that contribute as well to ill health. So our vision is a little bit different about how we take on this work. We envision a better future for our most under-resourced and highly burdened areas by working in collaboration with communities front and center at all that we do to become more resilient to environmental threats and to be the voice that's speaking against those environmental conditions. We want to make sure that there are strengthened regulations to protect population health and working with the industry to make sure that we see higher rates of compliance among those industrial facilities. We hope to have fewer and less severe incidents as a result of that, and reduce toxic emissions and improved environmental conditions but also our ability to respond both in prevention and in reaction when we have these problems. We're looking to strengthen the ways that we do that in much better, more culturally competent and effective ways, because we are doing them in partnership with the communities and the people that live in those communities. Some of the prevention strategies, we're working on all of this. This isn't something that public health does alone. We work with the fire department, the hazmat group. We work with our Office of Emergency Management. We work with our Parks and Rec. We work with all the different departments because we couldn't do this. But we're really leading on thinking through what does prevention, effective prevention, really look like. And again, I mentioned these things earlier, but it's really focusing for stricter enforcement, advocating for stricter enforcement, increasing our focus in all of these decisions about regulations around health protection. Oftentimes, health is lost from that discussion, and it needs to be front and center. And then promoting community empowerment and improved monitoring of the conditions that we do along with others. Achieving health equity, we truly believe as a department we're changing the way we do business. We're in the process of putting together a Center for Health Equity, and one of the key cornerstones of that work will be environmental justice. Another cornerstone of that Center for Health Equity will be addressing the inequities in birth outcomes, particularly among African Americans and whites. And the core strategies that we're thinking of as a department as we work on health equity is to make sure that we have data, that data is shared transparently with all of you, with our partners, with communities, that we are improving the way in which we communicate as we learn about hazards, as we learn about issues, that we improve the way we communicate that and make that data accessible, that we are investing in communities as those will be the partners and the key ones that create the solutions for this, and that we're focusing on policy and practice change, both in the way we do things as well as where we have evidence base that things can be done more effectively, and sharing that evidence with others. And then guiding principles, I think I've talked about this already, but we believe deeply we must be accountable to our community partners. We believe in integrity and transparency in our internal and external processes, and that, again, the data needs to be available to all, that our thoughts about how we work on things need to be out there and available to folks, that we believe in collaboration. We can never do this work alone, and shared learning. What we learn, we need to share with others so that we don't lose this knowledge base as we move forward and forget about the history. And then a deep commitment to racial justice and social change. And so thinking about that, it helps us to rethink the way we ask the questions when we see conditions in individuals or in communities. Instead of saying, if somebody is unhealthy, how can we promote healthy behavior? We talk about how can we target the dangerous conditions and reorganize land use and transportation policies to ensure healthy spaces and places. And instead of saying, wow, how do we reduce the disparity between black, white birth outcomes, we say, how do we eliminate the inequities in the distribution of power and resources that shape that health outcome in the first place? And when we talk about sort of, the traditional public health, and I'm going to be critical of my field right now, but the rescue programs that we have, instead of doing that, what types of institutional and social changes are necessary to tackle these health inequities? And let's think broader and bolder about what those are and what we do about them. And how can we, instead of saying how do individuals protect themselves against health disparities, it's the community organizing and alliance building that are necessary for us to protect those communities. Not one of us alone, but all of us together. We all own that responsibility and need to work together on it. So with that, I want to say a deep thank you to all of you for your work, for your commitment to the work that you do, for the changes that you make every day in the lives of people that live in your communities. We are in huge gratitude to all of the work you do, and I hope you have a fabulous conference today. There's a little bit of time if you want to ask questions, and There's some microphones going around if anybody has a question.
Thank you, Cindy. I want to commend the Department of Public Health and you for the work you've done for so long, and that is so cross-cutting and so forward-thinking. The issue of the X side and the regulatory ability to address that, is that based on county, state, or federal law, and can be something that is exported throughout the state and maybe even the nation? I think it's really great. Thank you.
Thank you. In terms of who regulates those industries, is that the question?
What you used as the base to go in and say, this is affecting public health, and you cannot come back and open that gas leak
with
again.
like an ELISO, yeah. So that health officer authority, it's granted to the local communities by the state, and we are probably the pioneers in using that authority in a very different way. As I said, public health has generally used that authority just for infectious diseases, and that's how it was thought up originally. So just to be honest with you, when we started to do it, we got a lot of pushback, not only internally from folks, wait a second, that's not what you use the health officer for, but also we ended up in court a lot. And so we are learning on how to do this. I mean, we're not lawyers, we're public health advocates. We saw a need. We have to protect these communities. That's our role in public health, and we need to raise the flag. And we're learning from how we do this. So I think we're probably in our infancy in doing it, and there's probably other opportunities for us to expand that.
Hi. I was on the Air Quality Management District Hearing Board for Exide and Aliso Canyon. And just to follow up on that question, I saw a lot of interagency rivalries, power plays where, say with Aliso, the Public Utilities Commission said, you'll just have to do whatever we say and forget what the locals and other agencies said. I wanted to say, in listening to you, I was inspired by the way you took people up to Sacramento. You took people who are patients, victims, whatever you want to call them, up to try and advance the public health agenda, and ask you how you might do that to address those interagency rivalries to make sure your public health mission is reflected in what other agencies do.
I think we're already starting to do that, and I cannot take credit for bringing the community up to Sacramento. I just want to be fully transparent and honest about that. That was Supervisor Solis. She was the one who felt this is the community that's impacted by it. They have a right to have a voice in this discussion in Sacramento, and she made sure there were buses and food for people so they could come up and testify and participate in that. And then one of the things that we advocated for in Sacramento was to have a hearing down here in LA so it would be easier for people to come and speak on that. And I think in the work that we're doing as we're designing this environmental justice work to prevent these things from happening, we're not doing that alone. We're meeting with the communities that are impacted by this and talking to them about how they see this should be done. And then in all of those interactions, it's their voice that gets elevated. It's not us. We're there to support them.
Hello. I just have a question regarding LA County's response to the Black infant and maternal mortality rate. What specifically is LA County doing around that? It is an emergency.
So thank you so much for asking that question. And there are a lot of things going on right now. We are working to expand the kinds of home visitation programs, and the access to home visitation programs is one thing. We're also working in collaboration with, it's being led by Jan King, our area health officer for the SPA 5 and 6, who's pulling together a community group. We've had 2 summits so far to get input from our partners to think about the kinds of interventions and how we design things. And it's very clear that we need better communication about the issue, better communication for women about their risks, but also we need to be thinking differently about the kind of social support systems that we have in place. And we're looking to other partners to help us expand the funding that we have to intervene for the kinds of programs that will really make a difference beyond, the kind of programs we've looked at some of the work that they've done, and I believe it was Wisconsin or Minnesota, where they had a very high rate of African American infant mortality, and they invested in some community collaboratives to do some very effective work. So we're looking at those kind of models and other things that we can do with community partners. And if you're interested, please give me your card before you go, so that I can make sure to connect you with those community summits that we're having on this. Thanks for that question.
Thank you for that very informative presentation. I have a question about how you started to infuse into the department the equity lens and how that has changed the way that you do your work.
So I think that that's a really, really good question, and I think we're still in our infancy in doing that. So thank you for asking it. I don't think that we're the experts yet, but we've done a number of things like doing trainings for all our staff across the department. We have brought in these concepts of health equity into the initial onboarding training that our staff get. We're looking to expand, again, we've sent one cohort through the Government Alliance on Race Equity and beginning to develop a race equity plan in partnership with other county departments and looking to send more people through those trainings. And then we are having a number of forums. And the concrete thing that we wanted to do, and we were able to do it in our budget proposal, was to implement a Center for Health Equity. And that gives sort of a physical, it's for the entire health agency, so it's not just for public health, it's for the Department of Health Services and the Department of Mental Health, a way in which we can bring together and coordinate activities that increase our ability to address those health inequities. So I can't say that we're experts yet. We're learning as we go. And I think I have to give a huge shout out to our new boss, Dr. Barbara Ferrer, who is the director of the department and started in February, who has just infused all kinds of new ideas about how we're going to do this. So I appreciate the question. I wish I had a better answer for you, but we're in our infancy. We're learning from others. We're learning along with others. And we're keeping that focus front and center, and how we get there is through improving the education of our staff, through improving the way in which we do business, and again, changing our questions. So we're not, for example, in the area of reproductive health, it's not mommy blame anymore. It's more on what are those conditions that created this in the first place? What is our role? How do we change that? And what is the role of others? And how do we get them engaged as well? So thank you for the question. Okay, sorry. Thank you all again.
So a giant thank you to Cindy Harding. Thank you, thank you. One more.